teeth also benefit immensely from exercise. Now, what I want to see, or what do I feel? Hello everyone, good morning. Once again, this is Time with Your Dentist on Mba TV Ghana. We are going to continue from our previous episode where we did talk about the basic anatomy of the mouth and the tooth, and one of the common dental conditions, that is dental caries or dental decay, or caca like we know it. We talked about what causes or what brings about this decay of our tooth. Today we are going to continue from that and talk about what we can see or what we can feel to understand or to know that there's something happening to our teeth. There's a disease process going on with our teeth, and that is going to be our focus for today. We are still going to talk about the treatment and, most importantly, prevention, and that is our goal. So like we said from the other time, the tooth is basically made up of 3 layers. This is a dentine, that's what I've removed. That's the first layer, the 9 shell, and then the second layer is the this is the enamel, that's the 9 shell. The second layer is the dentine, and the red portion here is the pulp or the living part of the tooth. So how do I know that I have a problem with my teeth or with my tooth? What are the signs? What would tell me that there's something happening, so I need to visit my dentist? Now let's look at this here. So this is a decay process in the tooth. So when the decay process starts, normally it starts from the enamel, that's the outermost layer of the teeth. We talked about it the last time. Now when the decay is in the enamel, you will not feel any pain, because the enamel protects the teeth against such sensitivity, pain, or anything. So when the decay is in the enamel, you will not feel any pain. All you feel probably, or all you see, is some food packing in there, because you have a hole or cavity in there, so you have bits and pieces of food getting in there, and so you realize that you may have to use something to pick out food debris after eating, some food particles after eating. That may be the only sign. You may see that the color of, or a portion of the tooth, the color has changed to probably chalky white to dark color. So when the decay is in the enamel, that is what probably you may see, or that is all that you see. And the food packing may give you bad breath, or food entering into the cavity or the decay or the hole in there may give you bad breath. So when the decay process is in the enamel, that is all that you feel. Now the dentine is made up of very tiny tubules or very tiny holes that links or that connects to the nerve. And so when the decay process gets into the dentine, that is where you feel some sensitivity or some twitches, and so you realize that you will not be able to take anything cold, you will not be able to take things that are hot, and so people will shun chocolates and ice creams when they are having this sort of sensitivity in the tooth. And so when the decay process is in the dentine, all you feel is some sensitivity, plus what I've talked about when it's in the enamel, food packing, bad breath, and the likes. From the dentine, from the enamel to the dentine, it will not give you serious pain, but the sensitivity may be severe. You may have bad sensitivity or twitches. So like I said, you may not be able to take certain kinds of food, cold and hot stuff, and some fruits like oranges and pineapples, acid containing foods, because it irritates the pulp, it irritates the dentine, and then give signal to the pulp, and then the brain interprets it as pain. So in that, then when the decay is in the dentine, that is what you feel. Now this is a progressive disease. When you don't do anything about it, when you don't do anything or you don't consult a dentist to sort it out for you, it's a progressive disease. So it goes on, travels through the dentine until it catches the red portion here that we call the living part of the tooth, or the pulp. Now when the decay process catches the living part of the tooth, that is the pulp, that is where you have pain. And that is where most of us will run to the dentist. But that is not what we want, because if the decay process gets to the pulp, treatment is expensive and it's time wasting. And so we don't want the decay process to get to the pulp. But if it gets to the pulp, that is where you have frank pain. And so when it gets there, you will not be able to chew because of the pain. The pain sometimes disturbs you in the night, disturbs your sleep and all that. But this is where most people will run to the dentist. But some people also will try other methods, putting things in there to try and stop the pain. Now let me say this, that when you put things in the cavity, there's a common drug that is on the market that people use. I don't want to mention names. They get in there and then so I'm fine, the pain is fine. What happens is that it kills the nerves. So yes, the pain may be gotten rid of, but what we should understand is that the infection is still in the tooth. So if you do not do anything about it, the infection will flare up and then you have that problem once again. Now if you don't treat it, when the decay gets into the pulp, it travels all the way down here, and then unfortunately my model did not show, but it forms like a boil under the tooth. And so most people will have a decay and they will have swollen face. That is a process that happens. Now when you have that, then it means that the decay process has been with you for a long time, and also the infection has progressed quite severely. And so most people will often come to the clinic when they have a swelling or when they have severe pain. That is not what we want. We want, first of all, to prevent the decay from happening in the first place. But if it happens, when you notice that it's in the enamel or it's in the dentine, when you have any funny feeling around your teeth, any funny twitches, sensitivity, don't try and see your dentist as soon as possible, because at that time treatment is less expensive and it's easier. And so we have to be mindful of that. So those are the signs or the symptoms that as a patient you feel. When the decay is in the enamel, you probably may not feel any pain. All you have is a color change, some food packing. When it's in the dentine, you have some sensitivity here and there and some twitches here and there. When it gets to the pulp, that is where the pain proper starts. And unfortunately, when it gets here, treatment, like I said, becomes a bit more expensive and a bit more complicated. So briefly, that is about the signs and symptoms of tooth decay. What I want to see, or what do I feel to know that I have a tooth decay, I have a tooth problem, is what I've spoken about briefly. So the next session I want to talk about, and that is very important to me as well, is we are looking at the treatment. Yes, what are the treatment modalities here? Now, like I said, when the decay is in the enamel, it's very easy to treat it. Okay, we just have to put in some filling material. So you visit your dentist will clean the decayed area, make it clean, get rid of all the infection in there, and then we'll put in a filling material. We have a lot of different type of filling materials that we can use. At this stage, treatment is less complicated and it's less expensive. Now when it gets into the dentine, it's the same thing. We can easily clean all the infected area and then put a filling material in there. When it gets to the pulp, yes, that is where the pain will start, but it doesn't mean that all hope is lost. We have another treatment modality we call the root canal therapy, that we can go in the tooth, get rid of all the infected portion, and fill the teeth nicely for you. But like I said, at this stage, it's a bit expensive, it's a bit time consuming for you as a patient and for the dentist as well. And so that is it. Treatment are available for this kind of condition, or when you have a tooth decay. Gone are the days when anytime you have pain in your tooth, you have to go and take it out. Those days are long gone. If the tooth is decayed and you are having pain and the tooth is not so badly broken down, it can be salvaged. We can do something about it for you, and that is what we call the root canal therapy. In due time, we will explain all these things into detail, and so that we'll have a better understanding of all the various treatment modalities that we have. Right, so let's look at the most important aspect of this whole thing, and that is prevention. If you do not take anything at all from this video, kindly do well to take note of this, because that is important to us. Because as dental practitioners, we want to prevent the disease from coming in the first place, so that we all have beautiful smiles, enjoy our meals, not burden ourselves with any decay here and there. So we are talking about the primary prevention, what we can do to prevent this in the first place. And I'll talk about about 5 or 6 things. But the first on my list is this: visit your dentist at least twice every year. And I'll explain to you why this is my first on my list. At least twice every year. That means every 6 months, just walk into any dental clinic and have your teeth checked. Why? Because when the decay starts in the enamel, if you don't have a trained eye, most of the time you may miss it. But then if you visit your dentist have that trained eye to catch it up. And let me say this: by the time your tooth decays from your enamel to catch the pulp, it should have taken roughly about 4 years. Which means that if you were visiting your dentist and the dentist caught it up, he would have sorted it out for you in time before it gets to the pulp. And a lot of the dental conditions, if you do not have the trained eye, it will be difficult for you to pick it up. And so it becomes necessary and prudent that you visit your dentist at least twice every year. If at worst, maybe once every year you can do it. So I always say that, listen, on your birthday, just give yourself a treat, give your teeth a treat. Have your teeth checked. There are a lot of dental clinics across the country now. Just have your teeth checked and don't get yourself in trouble with tooth decay and its issues. And so that's the first thing: visit your dentist twice every year, at least once a year, if the twice may seem quite a lot for you. That is the first. The second thing is what we eat. Now, from our previous episode, we talked about the fact that we have bacteria, and the bacteria feeds on the food, and they have some high love for foods that are rich in sugars and all that. And so I would say that let's limit our sugar intake. And so a better world now involves taking less sugar, and it's across. I mean, when you take less sugar, you are preventing a lot of things: diabetes, obesity, and all that. And in addition to that, you are also protecting your teeth, because if you are not feeding these organisms with a lot of sugar, they will not have time to produce a lot of acid that destroys the teeth. So let's limit our sugar intake. That is taking less sugar, snacking in between meals. Try and let's do it moderately if you cannot stop at all. Let's do those things in moderation. Now another thing is that if you want to snack, we advise vegetables, fruits. That is better, and especially for our children, we pack their bags with all sort of sugar-containing substances, sugar-containing drinks and biscuits. Let's start with them on fruits and healthy meals that will help the kids. So that is the second thing. Let's take less sugar, increase our vegetable intake as much as possible. If you can, stop in between meals, snacks, but if you cannot, let it be a healthy one. The third thing is that let's develop the habit of flossing. Now, the flossing is what we use to clean in between our teeth. Okay, so in addition to brushing, let us also try and floss in between our teeth. Now I'm going to show you what the floss looks like, so that we can hear. So this is a dental floss, very common everywhere now, and this now they've made it very easy so it's easy for you to clean in between your teeth after brushing. Most of the time you can do that, so that the food debris that hides in between the teeth can easily be taken off. Now the fourth thing I want to talk about is brush twice every day. Twice every day. I always make a joke that if you want to brush once a day, I don't have a problem, but try and do it in the evening. When you wake up in the morning and you don't want to brush, well, that is up to you. But the reason for us advocating for brushing twice a day, especially in the night, is you're going to sleep 6-7 hours. These organisms that we talked about have all the time in the world to do their thing, produce a lot of as much acid as much as possible, and so you want to prevent that. So if you brush, the fluoride mitigates or buffer, serves as a buffer for the acid that is produced during the night, and that will help reduce the decay process, or not even start the decay process at all. And so brushing twice a day is what we advocate, and especially for our children, let us encourage them to do that, so that they'll pick up that habit of brushing twice a day. And finally, I want to talk about exercise. Yes, we know that exercise, of course, helps every aspect of the body, and it may amaze you to also know that the teeth also benefit immensely from exercise. Now, what happens when you exercise? You increase blood flow to the area, to our mouth, and that once you have that increased amount of blood flow to the area, it helps decrease some of these disease conditions that we talked about. So in a nutshell, this is, basic things that we can do to prevent dental diseases, dental decay. You see, the first time I talked about the fact that it is a common condition in the world now. The good news is that it is so preventable. It is all about knowing your risk factors and taking care of the risk factors, and it will be good to go. So this is where time will bring us to today. I thank you so much for once again making time to be part of this session. I'm Dr. Harry Boateng's once again time with your dentist on Mba TV. See you next week, God willing, and do well to subscribe on Mba TV. We'll be talking a lot more about the second common oral condition that we encounter, and so do well to stay tuned, and let's have a good discussion. Thank you.